A man goes to the hospital for a sore shoulder. Nothing dramatic. He just can't lift his arm above his head without a strange, deep ache. The doctor orders an X-ray, expecting to see a torn muscle or an inflamed joint. Instead, the radiologist pauses on the image for a long time. Just above his collarbone, sitting quietly in the soft tissue of his neck, there is a bone that should not be there. He has lived his entire life with an extra rib growing out of his spine, just above the normal rib cage, and he never felt it until it started pressing on a nerve. He is not a medical anomaly in some tabloid sense. He is one of a small percentage of ordinary people walking around with a piece of skeleton that most humans simply do not have. Most of us were taught a specific number in school. The adult human skeleton has 206 bones. It sounds precise, almost like a law of nature, something carved into biology textbooks and never questioned again. But that number is really just an average, a common outcome, not a guarantee. Newborns are actually born with close to 300 separate bony pieces, many of which fuse together as the body grows through infancy and adolescence. Even in adults, some bones fuse or separate differently from person to person, depending on genetics, developmental timing, and sometimes pure chance. Add in accessory bones, extra vertebrae, missing bones, and unusual joints, and the skeleton stops looking like a fixed blueprint. It starts looking like something closer to a range of possibilities, shaped gradually as each of us develops in the womb and grows through childhood. So what does that range actually include? To answer that, we're going to move through the skeleton from head to toe, starting with something relatively common and ending with a condition so rare and so serious that it changes what the word skeleton even means. We start at the skull. During development, the bones of the skull form as separate plates that gradually fuse together along lines called sutures, seams that run across the top and sides of the head, like the stitching on a baseball. In most people, these sutures fuse into smooth, simple lines by adulthood, but in a significant number of people, extra small bones form along these suture lines, almost like additional puzzle pieces wedged between the main plates. These are called Wormian bones, named after the 17th century anatomist Ole Worm, who first described them in detail after examining skulls collected from across Europe. They're usually harmless, and most people who have them never find out, because nobody looks closely at the seams of their own skull unless a CT scan happens to catch one. Estimates suggest a meaningful percentage of the population has at least one Wormian bone, though exact numbers vary depending on how carefully the imaging is done and which population is studied. Some skulls have just one or two small fragments. Others have dozens, scattered like a mosaic along the suture lines, a pattern that anthropologists have even used to help identify skeletal remains from archaeological sites. Related to this is the metopic suture, a line that normally disappears in early childhood as the two halves of the frontal bone fuse into one solid plate above the eyes. In some adults, that suture never fully closes, leaving a faint vertical seam running up the forehead, visible only on an X-ray or CT scan. Again, harmless. Just a different developmental outcome, invisible from the outside, carried for an entire lifetime without ever causing a single symptom. From the skull, we move down to the neck, where variation starts to matter more, because the neck is a narrow corridor packed with nerves, blood vessels, and moving joints. This is where our opening story lives. A cervical rib is an extra rib that grows from the 7th cervical vertebra, the lowest bone in the neck, above where the normal rib cage begins. It occurs in a small percentage of the population, generally cited as somewhere around 0.5% to 1%, and it can appear on one side or both, sometimes as a fully formed rib and sometimes as just a small bony nub. In most people, it causes no problems at all. It simply exists, a small bony spur that shows up if someone happens to get imaging for an unrelated reason, tucked quietly beside the collarbone for an entire lifetime. But in some cases, that extra rib narrows the space where nerves and blood vessels pass from the neck into the arm, a condition known as thoracic outlet syndrome. That's when people start noticing tingling, weakness, or pain radiating down the arm, sometimes for years, before anyone connects it to a bone they never knew they had. Doctors sometimes describe these patients as going through a long diagnostic journey, tested for carpal tunnel syndrome or nerve damage elsewhere, before an imaging scan finally reveals the actual cause sitting quietly at the base of the neck. Further down the spine, a rarer and more visible variation can occur. Klippel-Feil syndrome is a condition in which two or more vertebrae in the neck fail to separate properly during development and remain fused as a single block of bone. It's estimated to occur in roughly 1 in 40,000 to 1 in 42,000 births, and it can range from barely noticeable to significantly limiting neck movement. Some people with a mild form live ordinary lives, only discovering the fusion through an unrelated scan taken decades later for a completely different reason. Others experience a shortened neck, reduced range of motion, or associated issues with nearby organs, since the same developmental window that shapes the neck bones also shapes some internal structures, including parts of the kidneys and heart. The severity depends entirely on how many vertebrae are involved and where, which is why two people with the same diagnosis can have completely different life experiences. Moving into the chest, the rib cage carries its own quiet variability. Most people have 12 pairs of ribs, but a noticeable minority are born with a 13th pair, usually attached to the lowest vertebra of the neck or the highest vertebra of the lower back. These extra ribs are typically small and functionally unimportant, often found only on imaging done for other reasons, easy to mistake for a broken bone by anyone unfamiliar with the variation. On the opposite end, some people are born with only 11 pairs, a much rarer variation that usually causes no functional problems either, since the surrounding muscles and organs simply adapt to the slightly different framework. And at the front of the chest, the sternum or breastbone can develop a small hole or gap near its lower portion, called a sternal foramen. It forms when the two halves of the developing sternum don't completely fuse at one point during fetal growth. It looks alarming on an X-ray if you don't know what it is, resembling a bullet wound or a tumor, and it has occasionally been mistaken for exactly that in emergency settings. But it carries no functional consequence whatsoever. It's simply a gap in fusion, discovered by accident, usually during a completely unrelated chest scan ordered for something like a cough or a car accident. Continuing down to where the spine meets the pelvis, we find one of the most common yet least known skeletal variations of all. The lower spine normally has 5 lumbar vertebrae, followed by the sacrum, a fused triangular bone at the base of the spine that connects to the pelvis. In a meaningful percentage of people, the boundary between these regions is not entirely clean. Sometimes the lowest lumbar vertebra partially fuses with the sacrum, a variation called sacralization, effectively giving that person one fewer freely moving vertebra than expected. Other times, the topmost segment of the sacrum fails to fully fuse, and instead behaves more like an extra lumbar vertebra, called lumbarization, giving the opposite effect. Depending on the population studied, these transitional vertebrae appear in somewhere between 4 and 20% of people, making them far more common than most of the traits we've covered so far. For most people, this causes no symptoms, and many go their entire lives without any indication that their spine is arranged slightly differently from the textbook diagram. But because it changes the mechanics of the lower spine, altering how weight and movement are distributed across the joints, it has been associated in some studies with a higher likelihood of lower back pain later in life, an association researchers are still working to fully understand. Before we leave the trunk of the body, it's worth mentioning the hands, where a different kind of variation shows up, one involving entire extra bones rather than subtle fusion patterns. Polydactyly, being born with one or more extra fingers, is one of the more widely known skeletal variations, occurring in roughly 1 in every 700 to 1,000 births, and it comes in several forms depending on which bones are actually present inside the extra digit. In some cases, the extra finger is a fully functional structure with its own bones and joints. In others, it's a small flap of skin and cartilage with no underlying skeleton at all, which is why some extra digits are simply tied off at birth, while others require more involved surgical planning. Less commonly known is the existence of extracarpal bones in the wrist itself, small accessory bones that sit among the 8 standard wrist bones, occasionally mistaken for fracture fragments on an X-ray by anyone unfamiliar with normal anatomical variation. The shoulder offers its own set of quiet exceptions. The acromion, the bony point at the top of the shoulder blade, normally forms from several separate growth centers in adolescence that fuse into one solid piece by early adulthood, usually by around the age of 25. In a subset of people, one of these growth centers never fully fuses, leaving a small, separate fragment of bone called an os acromial. It's often discovered in athletes or after a shoulder injury prompts imaging, and while it's usually silent, it can occasionally contribute to shoulder impingement, a pinching sensation during overhead movement that can be mistaken for a rotator cuff tear. Nearby, the body is scattered with small, independent bones called sesamoid bones, embedded within tendons, rather than connected directly to the skeleton the way most bones are. The kneecap is the largest and most familiar example, but smaller sesamoid bones appear in the hands and feet as well, and their number and exact position vary meaningfully from person to person, sometimes differing even between a person's left and right sides. Some people have extra sesamoid bones that show up incidentally on X-rays of the foot, occasionally mistaken for small fractures by anyone unfamiliar with the variation, leading to unnecessary casts or immobilization before a specialist recognizes the pattern. The feet carry the same pattern all the way down. An accessory navicular bone is an extra piece of bone or cartilage that sits near the main navicular bone on the inner side of the foot, present in an estimated 4 to 21% of people, depending on the study population. A wide range that reflects how differently it can appear on imaging and how inconsistently it gets reported. Most people never know it's there, and it remains a completely silent passenger for their entire lives. A smaller number experience pain along the inner arch, particularly during activity, because the extra bone can be pulled by a nearby tendon, sometimes requiring rest, bracing, or in persistent cases, surgical removal. Elsewhere in the foot, some people are born with a tarsal coalition, an abnormal fusion between 2 of the small bones in the back of the foot that are normally separate. It's uncommon, appearing in roughly 1 to 2% of people, and it can restrict the natural flexibility of the foot, enough to cause pain that is often initially mistaken for a sprain, sometimes going undiagnosed for years, because the stiffness is assumed to be a soft tissue problem rather than a bone fused where it shouldn't be. All of these variations share something important. They are differences in how bone forms, fuses, or fails to fuse during development, and in the overwhelming majority of cases, they are silent. They exist quietly inside ordinary people, discovered by accident on an X-ray taken for something else entirely: a sprained ankle, a car accident, a routine scan before surgery. But there is one skeletal condition that breaks this pattern completely, because it does not stop at variation. It actively builds an entirely new skeleton where one should not exist. Fibrodysplasia ossificans progressiva, often shortened to FOP, is one of the rarest genetic conditions known to medicine, estimated to affect roughly 1 in 2 million people worldwide. It's caused by a mutation in a gene called ACVR1, which normally regulates how the body repairs soft tissue after injury or inflammation. In someone with FOP, that repair process goes catastrophically wrong. Instead of healing with normal scar tissue, muscles, tendons, and ligaments gradually turn into bone, a process doctors call heterotopic ossification. The process is often triggered by injury, inflammation, or even routine medical procedures like injections or biopsies, which is why doctors who recognize the condition are trained to avoid unnecessary needle sticks, muscle injections, and unnecessary surgery in patients who have it. Even something as minor as a bruise or a flu shot can, in some patients, set off a flare that leaves permanent new bone behind once the swelling subsides. Over years, this abnormal ossification builds bridges of bone across joints, locking the shoulders, hips, spine, and jaw in place one at a time, usually starting in childhood and progressing gradually through adolescence and adulthood. People living with FOP essentially develop a second, extra skeleton, layered outside the original one, progressively restricting movement until basic actions like eating, breathing, or turning the head become difficult. Many patients describe the sensation of watching their own body slowly lock into place, joint by joint, over the course of years, a progression that is as psychologically demanding as it is physically limiting. There is currently no cure, though researchers studying the ACVR1 pathway are working on treatments that could slow or halt the process. And some experimental therapies targeting the same genetic pathway have shown promise in early clinical trials in recent years. FOP represents the far edge of skeletal rarity, not a silent variation discovered by accident, but a visible, life-altering condition that reshapes the body from the inside out. Why does the skeleton have this much room to vary at all, from harmless extra bones in the skull to something as severe as FOP? Part of the answer lies in how bone actually forms in the first place. Unlike organs that develop from a single continuous structure, the skeleton assembles itself from dozens of separate ossification centers scattered throughout the embryo, each one a tiny site where cells begin laying down bone independently of the others. These centers grow, expand, and eventually fuse together according to a genetic timetable that is remarkably consistent, but not perfectly so. Small shifts in timing, genetics, or even environmental factors during development can cause a suture to stay open a little longer, an extra ossification center to form where it normally wouldn't, or two centers to fuse when they should have stayed separate. Multiply that process across an entire skeleton with dozens of independent construction sites, each one following its own slightly variable schedule, and some degree of variation becomes almost inevitable. Conditions like FOP sit at a different level entirely, not a timing shift in an existing process, but a single gene mutation that hijacks the body's entire soft tissue repair system. The distance between a harmless wormian bone and a condition like FOP shows just how wide the spectrum of skeletal biology really is, ranging from cosmetic curiosities to conditions that reshape an entire life. So the next time someone tells you the human body has exactly 206 bones, you can tell them that's just the most common answer, not the only one. Somewhere in the world right now, someone is walking around with an extra rib pressing quietly against a nerve in their neck, feeling nothing or feeling everything. Somewhere else, a doctor is looking at an X-ray and trying to explain to a teenager that the stiffness in his shoulder is not a sports injury, but his own body slowly building a second skeleton around the first. Between those two extremes sits nearly all of us, carrying small, unnoticed differences that make each skeleton, quite literally, one of a kind.